Hello and welcome. My name is Drew Stivers. I've shared a short summary of my professional background at the end of these slides. The title of this presentation is Principles of Medication Safety Risk Identification. This is the relevant financial relationship disclosure for this presentation. These are the learning objectives that will be addressed during this presentation. These are the key abbreviations that will be used in this presentation. And finally, before we begin, here is a self-assessment question. We will return to the self-assessment question at the conclusion of this module, and I'll provide an answer and discuss the rationale. I'd like to begin our discussion on risk identification by highlighting ASHP's statement on the role of the medication safety leader, which defines the key responsibility of these leaders in developing, implementing, and evaluating medication safety initiatives within healthcare organizations. A core focus of this statement is that medication safety leaders play a critical role in the planning, development, review, and evaluation of an organization's medication safety plan, a process that requires a deep understanding of risk concepts and prioritization to minimize patient harm. To me, this statement underscores the importance of the content covered in the following modules. As medication safety leaders, we must not only develop an ability to identify and assess risk within our organizations, but also be strategically empowered to lead efforts in mitigating medication-related harms. Risk identification is a foundational element of medication safety because it allows us to proactively address system vulnerabilities before errors reach patients. Without a strong risk identification strategy, healthcare organizations are left reacting to errors rather than preventing them. Additionally, understanding risk helps us to prioritize improvement efforts, ensuring that resources are directed toward the areas of highest impact. Medication safety leaders must champion this process by fostering a culture of safety, leveraging both proactive and reactive risk identification methods, and integrating evidence-based strategies to continuously enhance medication use systems. A core responsibility of any medication safety program is the detection and assessment of risk. Applying structured risk detection methodologies is essential to proactively identifying vulnerabilities and preventing patient harm. However, it's important to recognize that there's no single gold standard method for identifying medication errors and adverse drug events. Each approach has its own strengths and limitations. Rather than relying on just one method, a comprehensive approach integrates multiple risk detection strategies, which allows for a more complete understanding of safety risks within the medication use system. During this module and those that accompany the module on risk identification, we'll cover a wide range of risk identification methods and learn that when used together, these methods are complementary rather than interchangeable, helping medication safety leaders detect, analyze, and address risks more effectively. Published in 2002, Pathways for Medication Safety, Looking Collectively at Risk, serves as a comprehensive guide for healthcare organizations to proactively identify, assess, and mitigate risks associated with medication use. This guidance document promotes a systems-based approach to medication safety by recognizing that common failure modes and implementation of strategies to prevent errors before they occur requires an interdisciplinary approach and mindset. This document is anchored around several key principles that serve as the building blocks for risk identification. They are recognition that the urgency for change and that change is imperative to addressing patient safety risks, highlighting the role of leadership in fostering a culture of safety, encouraging a collective organization-wide effort in identifying risks, providing a structured framework to assess vulnerabilities in the medication use process, promoting proactive risk reduction strategies rather than reactive responses to errors, and supporting a culture of safety where healthcare professionals feel empowered to report and address potential medication safety hazards. So let's take a closer look at these principles and consider how to incorporate them into a broad medication safety risk identification strategy. The first principle we'll cover is that change is imperative. To understand why, we need look no further than the landmark publication To Err Is Human. Since its release in 2000, this report has been a catalyst for patient safety efforts worldwide, highlighting the profound impact of medical errors, not just on individual patients, but on the healthcare system as a whole. When examining the research behind To Err Is Human, we find key risk detection methods that continue to shape patient safety work today. One notable example is the Harvard Medical Practice Study, which relied on medical record reviews to identify adverse events. This approach remains a cornerstone of risk assessment, and we'll explore its applications further in this module. A fundamental principle of patient safety improvement is systems thinking. As patient safety advocates, we must move beyond the idea that hard work and diligence alone can prevent errors. Instead, real improvement comes from changing systems that shape how care is delivered. Without structural change, even the most dedicated individuals will continue to work within flawed systems that allow errors to occur. Finally, recognizing the need for change is just the beginning. To drive meaningful improvement, we must also understand the principles of change management. This topic is explored in greater depth in another module of this curriculum, but it's essential to acknowledge that simply identifying the need for change is not enough. Success really depends on our ability to implement and sustain it. Leadership committed to fostering a culture of safety is essential for building and sustaining a successful medication safety program. Two questions that are critical for leaders to consider is how do we initiate and sustain process improvements, and how do we identify where improvements are needed? Let's start with that first question, how do we sustain improvements? And we'll consider it from the perspective of a strategic plan. In the Pathways for Medication Safety document that I mentioned earlier, there's a quote that I feel best highlights the importance of strategic planning when it comes to medication safety efforts. That quote is, "Strategy defines the organization's intent, where it wants to be in the future, and encourages everyone to work together to achieve common goals." Sustaining process improvements requires a clear strategic plan for medication safety, and that has to align with the organization's broader goals and future vision. If your organization already has a medication safety strategic plan, take a moment to assess how its goals support long-term improvement efforts. Does it provide a clear direction? And are objectives actionable and aligned with the desired future state? If your organization hasn't yet started strategic planning around medication safety, I'd consider you to leverage the principles from this program to advocate for one. Engaging leadership and securing their support is crucial for embedding medication safety as a core organizational priority. Without a defined strategy, efforts to improve safety may be short-lived or inconsistent. Leadership plays a key role in ensuring patient safety is not just an initiative, but a sustained commitment. Now let's turn to that second question. How do we identify where improvements are needed? The goal of this module is really to help answer that. So while strong leadership is critical to this effort to identify where improvements are needed, you really must go beyond that high-level endorsement. This should really foster frontline involvement and ensure that frontline staff are not only aware of safety efforts, but are directly engaged in them. Leaders should support the development of frontline teams so that they become integral to change efforts, growing into subject matter experts in patient safety. It's also important to establish a structured feedback mechanism that keeps this frontline staff engaged in safety efforts. These frontline team members dedicate their time to process improvement initiatives, report unsafe conditions, and help us identify risks, all while managing their daily responsibilities in patient care, medication distribution, and dispensing. And because they're closest to the actual workflow, their insights are truly invaluable. We really need to seek their perspectives and incorporate them into decision-making, especially when changes directly impact their work. At the end of the day, the frontline team members are our greatest asset in identifying and mitigating risks. They're the ones who can help us see safety gaps firsthand and can provide practical, real-world solutions for risk reduction strategies that will truly work. Another key tool that aligns with leadership support is the Culture of Safety survey. These surveys can help assess the organization's overall safety culture, identify areas where staff feel engaged or disengaged, and pinpoint where there's a potential for stronger buy-in. They're excellent tools for identifying improvement opportunities and setting priorities for future safety efforts. Ultimately, strong leadership isn't just about setting the vision. It's about ensuring that everyone is engaged, involved, and aligned in advancing patient safety. When leadership actively fosters a culture of collaboration, communication, and frontline empowerment, real and lasting improvements in medication safety become possible. A core principle of any medication safety program, and one that's explored extensively in this module and throughout the curriculum, is the ability to identify error-prone processes. The ability to recognize where risk exists is fundamental to preventing medication errors and improving patient safety. However, identifying risk isn't always so straightforward, which is why having the right strategies and tools is essential. To drive meaningful improvements, it's critical to first clarify the current state. We can't really improve what we don't fully understand, So whether it's medication prescribing, dispensing, administration, or monitoring, you need a clear picture of the existing workflows to determine where risks are and where changes are needed. Like any quality or performance improvement effort, an accurate assessment of the present situation is the foundation for building a safer future state. And so there's several key ways to identify risks, and they generally fall into two categories, retrospective and proactive approaches. So our retrospective risk identification methods look back at errors or harm that have already occurred. Medication error report review and root cause analyses are common tools in this category. And while these methods can help to reveal valuable insights, they rely on past events and may miss risks that have not yet led to harm. Proactive risk identification, on the other hand, is an approach that instead of waiting for an error to happen, seeks to anticipate risks and intervene before harm occurs. Tools like failure mode and effects analysis, or FMEA, observational audits, and frontline engagement help to uncover risks before they escalate into errors. These two categories of risk identification will be explored further as we continue on through this module and other modules throughout the curriculum. One essential principle of risk identification is to go where the work is done, because that's where the risk exists. In lean methodology, this concept is known as going to the gemba. The term gemba comes from the Japanese word meaning the real place, and in healthcare, it refers to the clinical setting where medication use and patient care occurs. Going to the gemba is a powerful practice because it reinforces another important idea. Everyone in the organization has a role in identifying and helping to mitigate risk. And who better to recognize the vulnerabilities in the system than the people actually doing the work? As medication safety leaders, we need to engage those at the sharp end, the frontline staff involved in medication management. And if you empower those closest to the process to play an active role in safety improvement, your efforts will be well received. Throughout this curriculum, we'll explore additional lean leadership concepts and practical lean tools that can be used to support risk identification efforts. And one particularly useful activity in lean management is the concept of process mapping, which visually represents workflows to reveal system breakdowns, inefficiencies, and most importantly, areas of risk. By mapping out each step of a process, you can really see where errors are likely to occur and implement targeted interventions that enhance medication safety. Ultimately, identifying error-prone processes is a continuous effort that requires awareness, engagement, and strategic action. So whether through retrospective analyses, proactive assessments, or using tools like going to the gemba and process mapping, the goal remains the same: to uncover risks, address vulnerabilities, and create a safer medication use system for patients and providers alike. Once risks are identified, the next step is to implement risk reduction strategies that directly address the vulnerabilities that you're identifying. The principle of adaptation and application is all about taking proven tools and methods and applying them effectively within your own organization. In healthcare, we often rely on evidence-based practices, strategies that have been tested, refined, and successfully implemented elsewhere. Looking to these established solutions can be invaluable in your approach to medication safety as well. A common pitfall here, though, is getting stuck in our own organizational silos. It's easy to feel like we're the only ones struggling with a particular challenge, when in reality many healthcare organizations have faced and likely solved similar issues. So instead of reinventing the wheel, we should seek actively to look for solutions outside our own organizations that have demonstrated success and adapt them to fit our unique settings. One way to break out of the siloed thinking is by leveraging collaborative resources, such as medication safety-focused listservs, professional networks, and industry forums. These platforms provide a space for exchanging ideas, learning from others, and sharing our own experiences. They remind us that we're part of a larger community working toward the same goal: improving medication safety. Interestingly, some of the most impactful patient safety strategies in healthcare didn't even originate in healthcare. Many of the tools we now consider cornerstones for medication safety and process improvement, such as root cause analysis, failure modes and effects analysis, Lean, Six Sigma, were all originally developed in industries like aviation, manufacturing, and engineering. These fields have long emphasized risk management, efficiency, and error reduction in their methodologies, and have been successfully adapted to healthcare settings. This underscores an important takeaway. Don't be afraid to look outside of healthcare for inspiration. Some of the best ideas for identifying and mitigating risk may come from unexpected places. So whether it's learning from high reliability industries, studying how other sectors approach risk reduction, or adapting tools that have proven effect elsewhere, broadening our perspective can help unlock powerful new strategies for enhancing medication safety. At the end of the day, though, adaptation and application requires a mindset of continuous learning. We need to collaborate and be open to new approaches if we're to really sustain those improvement efforts. By applying these proven strategies and staying engaged with a broader patient safety community, we can drive meaningful improvements and create safer medication use systems within our organizations. The final principle is getting started and spreading the word. No matter how well designed a medication safety strategy is, it won't be successful without broad engagement across the organization. Strong leadership support is essential, but just as important is ensuring that frontline staff feel empowered to actively participate in medication safety efforts. One of the most effective ways to build this engagement is through transparency and open communication. People are far more likely to take ownership of medication safety when they understand that their contributions matter. By fostering a culture where safety is everyone's responsibility, we can create environments where identifying and mitigating risks becomes second nature. This isn't just about increasing awareness, though. It's about making medication safety a shared commitment. The more you communicate the importance of identifying risk, the more likely it is that frontline staff will feel invested in this process. And the greater level of buy-in might lead to more detailed and comprehensive risks that are uncovered, which in turn lead to stronger and more actionable risk reduction strategies. Ultimately, medication safety isn't something that can be achieved in isolation. While many of you who are taking this module might be working in roles that focus on medication safety, your efforts really are aided and improved by a collaborative effort, one that starts with leadership but is sustained by those at the front lines of patient care. The more effectively that you can spread the word and engage others in this work, the more successful your organization will be at building a safer medication use system. With that, let's shift gears and focus on our next step, developing your ability to see and identify risk. Many of you are likely familiar with the Swiss cheese model, a concept that appears throughout this curriculum. It's a powerful way to illustrate the reality of imperfect systems, the ones we all operate within each and every day. No system is flawless, and whether the weaknesses are large or small, they all have the potential to impact medication safety. When it comes to risk identification, the Swiss cheese model helps us visualize where our vulnerabilities are. Each slice of cheese represents a workflow or system put into place to help prevent errors. However, those systems and workflows likely have weaknesses, represented by the holes in each cheese slice. A single hole or gap might not lead to patient harm, but when multiple holes align across our systems, a serious safety event can occur. And that's why it's so important to identify where our system vulnerabilities are, to be able to see the holes in our processes, workflows, and systems. Being able to see these holes allows us to assess the efficacy of the barriers or safety strategies we've already put into place and to ask if those safeguards are working as intended. If we can recognize the limitations and deficiencies in our strategies, we'll be much more effective in designing and implementing system improvements that actually prevent errors. While the Swiss cheese model helps us to think about what systems and vulnerabilities exist, another framework which I find to be more helpful in understanding those systems are displayed in this infographic, which comes from the Systems Engineering Initiative for Patient Safety, or SEIPS model, which is rooted in systems thinking, a crucial concept in patient safety. This model challenges us to move beyond focusing on individual errors and instead examine the entire system to understand why risks exist and how errors occur. A core principle of the SEIPS model is that everything in a work system is interconnected. When evaluating risk, we can't just look at a single person, step, or error in isolation. We have to consider the entire process and the way different components interact. The work system in the SEIPS model is made up of 5 key elements. The first is people. These are the healthcare professionals who perform tasks and includes their skills, experience levels, and workloads. The second is tasks. These are the specific activities carried out in a patient care, including the complexity of that task and variability of tasks that exist across the work unit. The third is tools and technology. These are the resources, software, and equipment that's used, and can include things like the electronic health record, automated dispensing cabinets, and infusion pumps. The fourth, environment, is the physical and organizational setting and also includes environmental factors like noise levels, lighting, and workplace design. And finally, organization. This is the leadership and culture that shapes workflows and includes things like policies, reporting structures, and training programs. These elements don't operate independently. They influence and shape one another. For example, a nurse using a new medication administration system may experience challenges if the technology isn't well integrated into their workflow, or if the environment, such as the staffing level or interruptions and distractions, makes it more difficult to use properly. By applying this systems perspective, we can begin to see risks more clearly. So instead of assuming errors happen because of individual failures, we can trace the root causes back to how the system is designed and proactively identify areas where changes are needed. Some key takeaways when applying this SEIPS model should include a shift from blame to design improvement. Here we would ask, instead of asking who made this mistake, we would ask things like what about the system allowed this mistake to happen? We can recognize that even well-trained, competent individuals can make errors, and that human factors like fatigue, cognitive load, and stress influence performance, so our system design should help to mitigate those risks associated with those factors. And also that understanding that a breakdown in one component might affect the other. If an EHR system is difficult to navigate, it may lead to task-related errors such as selecting the wrong medication that might impact patient outcomes. By aligning your perspective with a framework like the SEIPS model, you can take a more systems-focused approach to medication safety within your organization. This allows you to assess how people, processes, and technology interact across the medication use system to uncover underlying system vulnerabilities and implement more effective and proactive safety interventions. A valuable resource for identifying risk in the medication use process is ISMP's 10 Key Elements of the Medication Use System. Developed by the Institute for Safe Medication Practices, these elements highlight the fundamental factors that have the greatest impact on medication safety. Each key element serves as a lens through which organizations can examine potential risks and common failure modes that contribute to medication errors. These elements provide a structured approach to evaluating medication safety within your organization and can serve as a conversation starter for frontline staff discussions, whether during safety rounds, team huddles, or process improvement initiatives. Over the next several slides, we'll explore each of these key elements, illustrating how they can be applied to identify risks and strengthen medication safety efforts. Accurate and readily accessible patient information is essential for guiding safe medication use. Healthcare providers rely on critical demographic and clinical details such as age, weight, allergies, and pregnancy status, and on patient monitoring information like laboratory results and vital signs to make informed decisions and monitor medication effects. When evaluating risk related to this key element, consider whether all healthcare providers, physicians, pharmacists, nurses, can easily access this information at the point of care. Other ways to assess risk related to this key element include looking at things like how patient information is displayed in your system. Are key details prominently shown in patient banners or in order verification screens? We can look at how medication orders are entered, and if there's a requirement to have a recorded weight or allergy status prior to those orders being entered. If not, this might create a risk, particularly for weight-based dosing or potential drug allergy interactions. We can look at how weight is recorded in your system. Does it require input in metric units, or can pounds be entered and converted? If conversion is allowed, are there safeguards to prevent errors such as alerts for potential miscalculations? Each of these considerations highlights potential failure modes that could increase the risk of medication errors. By critically assessing how patient information is documented, accessed, and verified, organizations can help identify vulnerabilities and implement safeguards to enhance medication safety. Ensuring accurate, up-to-date, and easily accessible drug information is essential for minimizing medication errors and supporting safe medication use. A tightly controlled, well-maintained formulary helps standardize prescribing and administration practices, reducing variability and risk. Healthcare providers should have seamless access to drug references, protocols, order sets, computerized drug information systems, and medication administration records to support safe and effective medication use. When assessing risk related to this key element, here are some additional failure modes you may want to consider. You may want to evaluate if standardized emergency drug dosing guidelines are in place. Do you have emergency dosing protocols clearly documented, and are those documents available on the code cart so that they are available in emergency situations, and that those dosing guidelines match the concentrations and dosage forms of the medication stocked inside of the code cart? Do those resources address a wide range of weight-based dosing that might be required to promptly and accurately manage emergency situations involving pediatric patients wherever they may occur? Here, mismatched information could pose a significant risk during code blues and rapid response situations that could be prospectively addressed by evaluating this key element. Another example that you may want to consider is how your organization responds to drug shortages. Do you have structured mechanisms in place to modify orders, protocols, and reference materials when inventories change? Failure to consider this prospectively may lead to inconsistent or outdated information due to supply chain issues, which can in turn lead to dosing errors and confusion. You may want to look to see if minimum and maximum dosing limits are clearly established, and if clinical guidance documents include these defined dosing limits to prevent excessive or subtherapeutic dosing. An example of this is looking at things like your insulin protocol or insulin infusion guidelines that might be used to manage patients in a critical care setting. And finally, another example for you to consider is how you evaluate new drugs before they're added to the formulary, and how you then introduce those drugs once they are approved for formulary. So things you may want to consider is, do you have a standardized checklist to evaluate safety concerns before a medication is added to the formulary? And does that include things like how medications will be administered and infused using things like the infusion pump drug library? Another example is that you may want to consider partnering with your informatics team to understand how new drugs are built once approved for formulary into the EHR systems. And obviously you'd want to look at things like, is there a checklist that can guide validation of those drug builds? And does that checklist include things not only like drug dosing that prescribers might be inputting into the system, but things like drug vial concentrations and pharmacy compounding directions that guide safe preparation. Ultimately, by prospectively assessing how drug information is managed, accessed, updated, healthcare organizations can enhance medication safety and reduce preventable errors and improve patient outcomes. Effective communication of medication orders and drug information is critical to preventing errors and ensuring patient safety. Miscommunication, whether due to unclear orders, inconsistent documentation, or poor coordination among providers, is a leading cause of medication-related harm. To mitigate these risks, healthcare organizations must standardize the way drug information is conveyed and eliminate communication barriers between care providers. When assessing risks related to this key element, you might consider the following. How is medication reconciliation performed across all care settings? Are there standardized processes in procedural and outpatient areas like radiology to identify high-risk medications? You might want to look at how medication dose ordering options are aligned across systems. Does your electronic health record provide dose ordering options that match the inventory and match your procurement systems? You may want to look at how complex medication orders are structured in a way that reduces risk. So for example, looking at your PCA orders or patient-controlled analgesia orders, these orders often include multiple variables that prescribers must enter and nurses must later translate into infusion pump settings. One risk point might be that the ordered sequence of the order entry by the prescriber might not match that the nurse is programming, and would be an easy opportunity for misprogramming and ultimate medication errors if not aligned. You may want to look at things like ambiguous or non-standard orders and whether those create safety risks within your organization. So orders for resuming all meds after transfer of care from a procedural setting. These orders lack specificity and can lead to unintentional omissions or duplications. You may want to look at things like hold orders within active medication instructions. So for example, some providers might put hold parameters within the administration instructions of an active medication order, which can cause confusion about whether the drug should be administered or not. Standardizing the use of things like resume and hold orders will enhance the medication safety practices across your organization. Ultimately, by critically evaluating how medication orders are communicated, reconciled, and translated into practice, Healthcare organizations can identify vulnerabilities and implement safeguards that enhance medication safety and reduce the risk of preventable harms. Clear, standardized drug labeling and packaging are essential for preventing medication errors. Healthcare organizations must ensure that all medications are clearly labeled, unit dose packaging is utilized wherever possible, and that proactive measures are taken to mitigate risks associated with look-alike, sound-alike medications, ambiguous packaging, and unclear or missing drug labels. When assessing risk related to this key element, some of the following might be considered. You might want to look at how look-alike, sound-alike medications are stored and distinguished. Are high-risk look-alike, sound-alike medications segregated within the pharmacy storage areas to minimize selection error? Do you have visual cues such as tall man lettering, colored bins, or auxiliary warning labels to flag look-alike, sound-alike medications? And you may want to ask if separating similar look-alike medications into different storage locations might help to reduce the risk of mix-up. These strategies for look-alike, sound-alike medications are all the more important as we consider the introduction and explosion of the use of biosimilar medications across our medication areas and health systems. We might want to take a look at drug procurement, specifically looking at how packaging differences of products being brought into the organization are considered. When selecting medications, do you consider labeling and packaging similarities between different products? And while I recognize that this is not feasible for all medications due to many constraints on the supply chain, drug shortages, and strategic vendor selection necessitated by contracting, looking at the packaging might help to mitigate confusion with some specific high-risk cases. So for example, a hospital that I previously worked at, we identified errors associated with our premixed heparin and our premixed magnesium sulfate because of similar packaging due to trade dress. So to reduce the risk of mix-ups, we restricted the procurement of one of the products, the magnesium sulfate, so that we could eliminate or at least minimize the potential for those products to be confused during drug selection. Finally, another idea for consideration about drug packaging is how medications that are brought into the organization as patient-owned medications are managed. Does your organization allow patients to bring their own medications and use during hospitalization? And if so, do you have a clear, error-proof verification process for pharmacists or other authorized health providers to identify, verify, and document those medications before they're administered to patients? Are certain medications that patients are on in the outpatient setting prohibited from being brought into the organization due to increased risks? So for example, you may want to look at your policies and procedures around patients who are on parenteral nutrition in the home and whether or not you would allow them to continue on those products or convert to your organization's supplied parenteral nutrition products. By critically evaluating how medications are labeled, packaged, and stored, and the procurement process associated with bringing medications into the organization, you can help to proactively identify the risks and implement targeted safeguards to reduce the likelihood of errors associated with drug labeling, packaging, and nomenclature. Standardizing drug formulations and concentrations and evaluating how they are stored both within and outside the pharmacy is a critical strategy for reducing medication errors. Many errors occur due to unnecessary variability in drug formulations, accessibility, or preparation steps. By minimizing access to high-alert medications, limiting or restricting floor stocks, and using commercially available standardized concentrations, healthcare organizations can significantly reduce the risk of dosing, compounding, and administration errors. When assessing risk related to this key element, you might want to look specifically at infused high-alert medications and specifically the concentrations that are used across your organization. You might want to ask if there's a possibility of standardizing to a single concentration for things like infused opioids, heparin infusions, and insulin infusions. You might want to look to ensure that if you are able to standardize, that all relevant order sets and infusion pumps are configured to support these standardized concentration and dosing units. And now obviously this is not going to be possible each and every time. There are necessary situations that arise where you may need to add additional concentrations to your formularies. So for example, you might have a standardized insulin infusion concentration that's used in your critical care areas to manage hyperglycemia, but you might also need a high concentration insulin infusion used for beta blocker or calcium channel blocker overdose, which is a much less common occurrence. You'd want to look at how those orders are restricted within your ordering systems and how those orders might be managed differently in things like your infusion pump drug library. And finally, you may want to think about strategies to indicate that this concentration variance exists for the pharmacists and technicians involved in the preparation and dispensing of the drug. Another example related to concentrations that you may want to consider is things like PCA. So you may be able to leverage a standardized concentration for things like a hydromorphone PCA, but you might also need to consider stocking a high concentration PCA to accommodate higher doses used for specific patient populations. Here you might consider the use of a 503B compounding organization to help standardize the preparation of the dose and to limit the potential for error that arises with packaging differences among different concentrations of PCA. Another example area that you may want to evaluate risk relates to the use of antidotes and reversal agents. You want to make sure that you have readily accessible and clearly guided protocols for use of these agents. So you may want to look at immediate access to emergency reversal guidelines for things like naloxone, concentrated dextrose, or lipid emulsion in your procedural areas. You would want to look to make sure that there are clear guidance for the storage and inventory levels that are set for these drugs. And so that might lead you to work with your operations and supply teams to ensure that there's systems in place to assure timely checking of expiration dates and inventory levels, so that these medications are maintained at a level where you're not left in a situation where a time-sensitive med is unavailable. Ultimately, by evaluating and refining your drug storage, distribution, and standardization strategies, you can proactively work to eliminate variability and reduce the likelihood of errors that come from storage, distribution, and overall drug standardization concerns. The safe use of drug delivery devices is essential for preventing medication errors. Healthcare organizations should proactively assess device safety risks before purchase. At your organization, you may want to advocate for, if it's not already in place, a structured review process for evaluating new medication-related devices. Ideally, as medication safety leaders, you'd be included on a multidisciplinary committee that assesses error-prone potential before approving new medication devices, and use methodologies like failure modes and effects analysis assessments before device implementation is employed. You'd also want to make sure that end users' feedback is sought as you evaluate new devices like infusion pumps, drug compounders, or other devices used in the pharmacy or out on the nursing floors. Evaluation of fail-safe protections like free flow protection, incompatible connections, and default settings should be conducted and are certainly an area where risk can be assessed. An organization should attempt to standardize device selection to minimize variability. I know that this is a particular area of focus and sometimes difficult discussion and decision-making with respect to infusion pumps, where infusions like large volume infusions, syringe infusions, patient-controlled analgesia, and epidural infusions all need to be considered and evaluated for how those will be delivered with respect to the infusion pumps that are selected. You may want to look at training and competency checks required of staff who use these devices to ensure that there's familiarity with using them before they're implemented. And finally, you may want to evaluate your organization's use of independent double checks. Here, you might want to look at whether an independent check of a drug compounding device is required, or if there are technology solutions like barcode scanning that sufficiently minimize risk. You may want to look at how independent checks of infusion pump programming are utilized to limit its use to higher risk tasks like titrations or multi-element or multi-step programming. By taking a systems-focused approach to your assessment of device-related risks, you'll be able to identify where the risks are greatest and appropriately target your safety interventions. Environmental conditions can significantly impact medication safety by increasing the likelihood of errors. Factors such as poor lighting, cluttered workspaces, high noise levels, frequent interruptions, and excessive workload create conditions that contribute to distractions that may result in error. When assessing risk related to environmental factors, some things that you might want to consider are if the medication preparation environment is designed to minimize distractions. Are areas where medications are prepared, both in the pharmacy and patient care areas, isolated from high traffic zones to reduce interruptions? Are the use of no interruption zones implemented in areas where medications are prepared or verified? For example, some organizations use floor markings, signage, or designated quiet zones to remind staff and visitors not to interrupt the medication preparation process. You may want to look at workspace conditions and ensure that they are optimized for safety. So is there adequate lighting in all medication storage and preparation areas? Are workplaces free of clutter, allowing for clear and organized medication preparation? And are barcode scanning stations, IV prep areas, and medication dispensing systems located in ergonomically designed spaces that minimize physical strain and the risk of error? You may want to participate in a review of staffing and workload levels that contribute to safe working conditions. Are staffing patterns evaluated to prevent excessive workloads that may lead to frequent fatigue-related errors? And are strategies in place to reduce alarm fatigue, specifically in areas with high and frequent competing alerts? You may want to look at best practices for safe medication environments and utilize resources like USP's Chapter 1066 on the physical environments that promote safe medication use to assess how lighting, noise control, and workspace organization impacts safety. Now, a lot of these are very challenging and difficult areas to focus on, specifically if your role or scope is medication safety. A lot of these intersect with other disciplines, other departments, or even other leaders within your organization who focus on frontline staffing plans, or environmental and facility design. And so these areas of risk identification are critical to be brought forward to those different groups. Ultimately, by identifying and mitigating environmental risk factors, though, organizations can improve focus, reduce distractions, and ultimately enhance the safety of medication preparation and administration. While education alone is considered a relatively weak risk reduction strategy, it becomes far more effective when paired with higher leverage system-based interventions. That said, ensuring staff competency and ongoing education is essential for promoting safe medication use and minimizing preventable errors. When assessing risks related to staff competency and education, you might want to consider the following. Are competency assessments in place for high-risk tasks like sterile compounding and for high-risk skills like drug level monitoring or knowledge of resuscitation algorithms? Something you might consider here is incorporating actual error examples into simulated training to ensure that those performing these tasks or skills are able to identify errors they might see in real life. Other areas of educational focus include things like new medications added to the formulary, the use and process for using non-formulary medications, high alert medications and their use across the organization, and just general medication error prevention strategies. As a medication safety leader, it's critical that you contribute to the ongoing education of staff, sharing with them medication errors and lessons learned. Here, you might want to consider development and dissemination of a routine safety communication like a newsletter or safety bulletin to highlight trends from error reporting and risk detection methods. So as an example, at a previous organization where I worked, we would send a monthly safety tip from the Medication Safety Committee that was based on actual errors that served as an ongoing learning tool. By ensuring that staff education is ongoing, competency assessments are structured, and that real-world learning is incorporated, organizations can build stronger culture for medication safety through staff competency and education. Patients play a critical role in preventing medication errors, especially when they are well informed about their medications and encouraged to ask questions. Effective patient education can enhance medication adherence, reduce adverse effects, and improve overall safety. So we should teach patients how to protect themselves from medication errors, both for themselves and for family members. As an example, a number of organizations have dedicated efforts to ensuring safe use of opioids, which includes education for the patient, but also for things like proper storage that promotes safety in the home. We should also develop educational materials that are accessible and understandable, and should provide education via validated, effective teaching methods. For example, many organizations utilize pharmacists to educate patients on high-risk therapies like anticoagulants, anti-rejection drugs, and others. In my organization, a team of dedicated pharmacists provides teaching to patients newly started on oral chemotherapy, ensuring that they have an understanding of all aspects of their care, how to safely take the medication, and things like how to properly dose if a drug is being titrated, how to properly monitor for unanticipated side effects. Obviously, each organization will need to independently assess programs like patient education to determine the best utilization of their resources. Finally, we should seek to include patients and family input on safety and quality improvement initiatives. As an example, again from my organization, we have a patient family member on a quality improvement project focused on our pharmacogenomic monitoring program for patients prescribed the chemotherapy drug fluorouracil or capecitabine. By ensuring clear, patient-friendly education, integrating pharmacist consults for high-risk medications, and reinforcing education beyond hospitalization, organizations can empower patients to play an active role in medication safety. Finally, our last key element of the medication use system focuses on quality and risk management. Healthcare organizations must have robust systems in place for identifying, reporting, analyzing, and mitigating medication errors. A non-punitive culture of safety is essential to encourage open reporting of errors and near misses, allowing organizations to learn from incidents and implement system-based solutions that prevent recurrence. Strategically deploying quality control checks ensures that those system-based improvements continue to work as designed, and that if changes are made elsewhere, they've not led to a negative impact on those previously implemented interventions. Here, we're also looking for a systems-based approach to prospectively detect future errors before they reach a patient. When evaluating risk related to this key element, some additional considerations include an assessment of formal education on patient safety and just culture. You might want to look to see if executives, department leaders, and frontline managers have completed structured training on patient safety principles, system-based error reduction, and just culture. In my organization, we've recently recommitted our emphasis and commitment to a just culture, which has included deployment of training for our frontline managers on just culture principles, something that our medication safety team in the pharmacy is intimately involved with and actively discussing during our meetings with our frontline pharmacy managers. You might also want to consider if leaders are actively involved in safety rounds and adverse event reviews to reinforce these learning-focused approaches to safety and systems approaches to safety interventions. You may want to partner with your patient safety and risk management departments to evaluate how your organization approaches error prevention strategy setting. As discussed previously in the module, does the organization have a strategic plan with respect to medication safety and how we approach risk identification and risk mitigation? You may want to look at how discussions about medication errors focus on system improvements rather than assigning blame to individuals, and that when errors occur, event analyses lead to process changes such as workflow redesign, automation, improvements, or standardization as opposed to focusing on the individual. If at your organization this is already happening, great. If not, these are great places to start at evaluating opportunities for improvement. Essentially, by fostering a culture of transparency, empowering leaders with patient safety education, and embedding medication safety into the organization's strategic priorities, healthcare systems can proactively manage risks, enhance reporting, and drive meaningful medication safety improvements. With that, we'll wrap up our review of our ISMP's 10 key elements for medication use and summarize what we've covered so far. So let's take stock now of what we've covered. As we've learned in the first section of this presentation, effective risk identification and medication safety requires a structured approach rooted in systems thinking. The Pathways for Medication Safety document outlines guiding principles that help organizations take a comprehensive approach to detecting and mitigating risks by focusing on principles like inspiring others to change, leadership support for a safety culture, identification of error-prone processes, adaptation and application, which is that concept of requiring a mindset of continuous learning, collaboration, and openness. And lastly, getting started and spreading the word, which highlights the need for a collective effort around medication safety, one that starts with leadership but is sustained by those on the front lines of patient care. These guiding principles form the foundation of an organization's commitment to advancing medication safety. In the section on seeing risk, we touched on two models, the Swiss cheese model and the Siebes model, which aid in our development of a systems thinking mindset and provide a framework for detecting system vulnerabilities. To understand and apply systems thinking to this work, we must recognize that risks arise not just from individual actions, but from how people, processes, and technology interact within the medication use system. In detecting system vulnerabilities, we're essentially locating the weak points, or the holes in the cheese, where failures can occur, so that we can address them. Finally, we reviewed ISMP's key elements of medication use, which ensure that each phase of the MedUse system is systematically reviewed for potential safety concerns using the lens of these foundational elements. In the remaining section of this presentation, we'll now shift our focus to reactive and proactive tools that can be used to identify and assess risk. We'll spend the remaining time in this module on tools that can be used both reactively and proactively to identify the risks within medication use system. These tools can help us identify risk and focus our attention around underlying or infrequently occurring risks, as well as assess objectively where those are. As a reminder, reactive methods focus on analyzing past events to prevent future errors, while proactive methods focus on anticipating risks before they occur. Listed here are some examples of both reactive and proactive methodologies used to identify risk that we'll spend some time discussing. Some examples of reactive risk identification methods include medication error reporting systems, which help us gather data on actual errors and near misses and evaluate trends and system vulnerabilities, as well as root cause analysis, a methodology used to understand root causes and contributing factors of significant safety events. Each of these methods is covered in further detail within the curriculum. During the next module, we'll explore in more detail some strategies for utilizing automation and technology data and trigger-based methodologies for risk identification. In the modules that follow the reactive methodologies, modules on proactive methods that will teach you more about methodologies like FMEA, the use of external data, and leadership safety rounding, an approach that provides an opportunity for direct engagement with frontline staff to identify safety concerns and reinforce a culture of open communication and learning. Reactive strategies are essential for uncovering real-world medication safety risks and provide tangible data to drive improvement. While they focus on errors and near misses that have already occurred, they are invaluable for tracking trends, measuring the effectiveness of interventions, and identifying areas that require immediate attention. One of the key strengths of reactive risk identification is its ability to provide objective, data-driven insights that can guide safety initiatives. Some examples of method-specific strengths include that direct observations and audits, which allow for real-time assessment of medication use processes, revealing workflow inefficiencies, policy deviations, and error-prone practices. Event reporting systems help us capture voluntary reports of errors and near misses, which highlight system vulnerabilities that may not be apparent through other automated tools. And the use of trigger tools and automation methods use predefined signals like lab values, medication orders, or alerts to proactively detect potential adverse events, even if they were not reported manually. By leveraging multiple reactive methods, organizations can establish multifaceted approaches to risk detection, and when used in combination, these strategies provide a clearer picture of medication safety vulnerabilities, which allow medication safety leaders to prioritize interventions, refine processes, and ultimately reduce harm to patients. While reactive risk identification strategies are valuable for uncovering medication safety issues, they have inherent limitations that must be acknowledged. By definition, these methods focus on past events. Because these methods identify errors after they've occurred, they may not be able to prevent future harm before it happens until they're fully realized and evaluated. These methods often are only capturing the tip of the iceberg due to their limited scope of detection. Many errors and adverse drug events go undetected due to underreporting, low sensitivity of detection tools, or the inability to capture latent errors that exist within system design. This bias towards sharp-end errors often results in missing latent system failures that contribute to these incidents, such as poor workflow design, suboptimal technology integration, or inadequate staffing and training. Often, these methods provide surface-level insights. Reactive methods often highlight only what happened, but provide little insight into why it happened, making it challenging to address root causes without further analysis. And finally, these methods are often very time-intensive in their investigation. Conducting a thorough event analysis, identifying contributing factors, and developing effective interventions require significant resources. Addressing latent condition demands even greater effort. To mitigate these limitations, healthcare organizations should consider an optimal balance of these reactive strategies along with other proactive risk identification methods. So let's return to our self-assessment question, which asks, which one of the following statements regarding medication safety risk identification is true? The correct answer here is D. First, let's review the incorrect choices. A, only those in dedicated medication safety or quality roles can effectively identify medication safety risks. This answer is false. Medication safety is a shared responsibility. Frontline staff, including physicians, nurses, pharmacists, and others, play a crucial role in identifying risks through their daily experiences. Many risks are first recognized by those at the front end or sharp end, making their input essential to an effective medication safety program. Answer choice B, which states methods for risk identification function independent of one another, is false, because risk identification methods are most effective when used together. No single method can capture all risks. For example, error reporting systems rely on voluntary reporting, which may miss certain risks, while trigger tools and technology data can proactively detect potential medication safety concerns. A layered approach increases detection sensitivity and provides a more complete risk assessment. Answer choice C, risk identification is all about strategy, safety culture doesn't really matter, is false, because a strong safety culture encourages open communication, error reporting, and learning from mistakes. Without a supportive culture, even the best tools and strategies won't be fully effective. Staff must feel safe to report errors and near misses without fear of punishment, enabling the organization to learn from incidents and implement systems-based improvements. And so our correct choice, option D, identifying medication safety risk requires not only the right tools, but the right mindset as well, is correct because it describes that effective medication safety risk identification goes beyond just the right tools. It requires a proactive mindset, a strong safety culture, and interdisciplinary collaboration. Risk identification is not a passive process, demands a strategic approach that integrates various methodologies while fostering an environment where staff feel empowered to report concerns without fear of blame. As outlined in ASHP's statement on the role of the medication safety leader, identifying areas of risk is a vital component of a comprehensive medication safety program. Effective risk identification goes beyond individual tools. It requires strategic, system-based approaches that integrates proactive and reactive methodologies. The guiding principles presented at the beginning of this section, along with the frameworks like Swiss cheese model and the SEEPS model, help us to develop our ability to see and prioritize risks. A strong safety culture further ensures that risk identification efforts lead to meaningful system improvements rather than isolated interventions. The tools discussed throughout this module, including direct observation, trigger tools, and technology-driven data, work together as risk identification portfolio to capture retrospective risks. By combining these tools with proactive mindset and leadership empowerment, medication safety leaders can effectively identify, mitigate, and prevent risks, ultimately enhancing patient safety across the medication use system. These are the references used to develop this presentation. Thank you for your time and participation.